The patients waiting in these cars for coronavirus tests are all kids, more than 500 so far, at a drive-through site set up by a children's hospital that's losing money hand over fist.
Our financial situation is devastating. We're losing over $1 million a day.
$1 million every single day.
$1 million every single day. We don't have as many children here in the hospital, and the supplies and all the things we need to do to take care of kids and families has just gone up.
They thought help was coming from the $2 trillion stimulus Congress passed last month.
Over $100 billion to support our heroic doctors, nurses, and hospitals.
But when the first $30 billion was doled out, kids' hospitals and pediatricians got left out. Hospitals that serve mostly low-income people got far less money. And coronavirus hotspots, they got no special treatment. Why?
We heard that from the many healthcare providers across the country that weighed in on this. They said the most important thing was to get these dollars out as quickly as possible.
So here's what they did. The government used the most robust set of data they already had in their computers. Last year's Medicare billings. Whatever slice of the Medicare pie a doctor or hospital got last year, they got that same slice of the $30 billion.
At Children's National Hospital, they don't really have a lot of patients on Medicare. It's for people 65 and older. But the hospital's revenues have plummeted 40 to 50% during coronavirus. Across the country, hospitals are postponing non-emergency procedures.
In general, we would budget for about 300 kids in the hospital a day, and we're running about 200 because we want to provide the capacity to help the system take care of the surge that's coming.
An NBC News analysis found that hard-hit coronavirus states, like Louisiana and Michigan, got far less per COVID-19 case than places like West Virginia and Hawaii, each with less than 1,000 cases. New York and New Jersey combined have almost half the country's coronavirus cases. But together, they got less than 1/10 of the first relief dollars.
How can that be? It can be because in the Senate, it became a game of political pork.
For St. Anthony Hospital in Southwest Chicago, it's a double whammy.
This money really has been a drop in the bucket in terms of the disproportionate amount of cost that we have due to COVID.
Chicago's a coronavirus hotspot, and St. Anthony is what's known as a safety net hospital. It predominantly treats lower-income patients on Medicaid, mostly African American and Hispanic. St. Anthony has about half as many Medicare patients as most hospitals, so their stimulus funding barely made a dent.
We fight for every cent to provide good quality care, but we shouldn't have to worry this much about solvency at the time we're trying to fight a pandemic. This is just unconscionable.
There could be better news within weeks. There's still $70 billion left to dole out to hospitals, and President Trump says this time it'll be different.
A significant amount of this money will go to the hospitals and hotspots, while a portion of it will reimburse hospitals for the cost of treating uninsured patients and for the coronavirus.
And Congress may add tens of billions more for hospitals in the next relief bill. But time is running short.
So let me get this straight. You have hospitals in your network with a week's worth of cash maybe on hand right now.
Absolutely. They will have problems meeting payroll and paying their vendors if we don't see relief, and relief targeted in the right ways very quickly. This is not a joke. This is serious business, and we're talking about people's lives here across America.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.